Hello, everyone. Greetings and welcome to today's webinar on supporting people in difficult times. This is an e-learning course on basic psychosocial skills. We will hear from the experience of its implementation in Nepal, Timor-Leste, and Sri Lanka. I'm your host for the day, Sadhani Rajpaksha from MHPSS.net. And I would like to invite you to use the chat to introduce yourselves if you haven't done so far yet. And during the webinar, please use the chat function also to give your insights, feedback, any questions that you have so that we can take them up into discussion towards the end of the webinar. And before you leave, there we have an exit poll. Please make sure to give us your feedback on that also so that we can keep improving ourselves. Finally, this webinar is being recorded. And it'll be made available for you even to view afterwards. Thank you very much for joining with us today. And next slide, please. So a little bit about today's webinar. We will be taking you through the journey of how the Supporting People in Difficult Times course was developed and its experience of implementation. And we will also use the breakout session to sort of give you a taste of what it looks like in practice. And we will take any questions with the team that's in place. Next slide, please. So we have an exciting panel today from the three countries. We have Suraj Koirala from TPO Nepal, who's the technical advisor, and his team joining from there. We have Iris Trapman and Maria D'Souza from Asia Foundation in Timor-Leste. We have Anand Galapati and Aloka Veerasekara from MHPSS.net, and Rehan Nimaduma, who's the program officer of Asia Foundation in Sri Lanka. And before we move forward, we will take you through a small teaser trailer of what supporting people in difficult times looks like.
Sinara had recently experienced violence at her own home once again, where she had to flee to Priya's house with her child.
Ranjit is a husband and father of two young children. Like many people in the community affected by the current crisis, he lost his job.
Thank you so much. So sorry, we had a small technical difficulty with the sound of the video. But moving forward, we will try our level best to not have any of these issues of technical issues. Before we go any further, we would like to know how this course came to be. And I would like to invite Anand to take us through that process. Over to you.
Thanks very much, Sadhani. Hello, everyone. To put the SPDT, as we call it for short, course in context, it really started, its origins and the source material comes from the Basic Psychosocial Skills manual that the IASC Reference Group developed in 2020, very soon after the start of the COVID-19 pandemic. essentially what happened was that many of the principles and elements of PFA were taken and reframed for the COVID-19 context. And this was, I think, done just within a month or two of the crisis really escalating, and was used and translated around the world. And at that time, the Asia Foundation Sri Lanka had been working on frontline support for contexts like the Easter Sunday attacks of 2019, and had been sort of working on strengthening first responder capacity. And as COVID-19 hit, the Asia Foundation and the Good Practice Group came together to develop an e-learning version of the BPS manual for frontline responders in Sri Lanka. And that was really well received, and it seemed to be very appropriate in a context where everyone had to be learning remotely, and an online course was, a relatively new thing in the Sri Lankan context. And because of the potential and the success of that course, there was an initiative from actually 3 different Asia Foundation country offices in Sri Lanka, Nepal, and Timor-Leste to expand coverage of this course. But in the process, the course was actually significantly reimagined and reframed. And I'm going to stop here and invite Aloka to take over and tell us a little bit about that process of taking what was the first version of this course was very sort of didactic. It was, as you can see in the module guide, it was these components that are to be found in the manual. But the second, the new version, the SPDT, was actually something quite different. Over to you, Aloka.
Thanks. Thank you, Anand. And it is indeed very nice to see you all. And thank you all for coming for the webinar today. So what I'm going to do now is to take you through the development process of this course, just to give you an idea of what it looks like to work with partners from 3 different countries, and also across 5 different languages. After this, Suraj, Iris, and Rehan will talk about their experience from a participant point of view on behalf of Timor, Nepal, and Sri Lanka, respectively. So we started this process back in late 2020 November. We mainly worked on contracting and other admin-related work, and also conducted partner review meetings with the Asia Foundation in Sri Lanka, Nepal, and Timor, as well as TPO Nepal. This was mainly to get to know the partners well, and for setting up the ground for the course development. Then in 2021 and 2022, our focus was mainly on developing the content, animated videos, and integrating the course content onto an e-learning platform and its dissemination, which I will explain briefly in the coming slides. So after completing the activities for this e-learning course, the Asia Foundation contracted us again for the Evolve project, which is the evaluate outcomes of the e-learning virtual exchange program, where we are trying to evaluate and review the outcomes of our program. Again, for this, we are working with same partners in Timor and Nepal. Also with this project, we are making some improvements for our online course. For example, including sign language interpretation for all the videos we developed, which we are planning to complete quite soon. Next slide, please. Okay, so what we did first was to understand the priority problems and needs to feature in our narratives. As you know, we're working with 3 different countries, country contexts, and each country had different expectations from this project. So from the very beginning, we wanted to make sure that all partners are represented equally in the narratives, and also that we address their priorities. So therefore, we asked each country to list down their priorities. As you can see in this slide, And then in our partner meetings, we reviewed all our priorities and agreed on common priorities that we wanted to focus. So in the end, we came up with six priority areas. For example, economic needs, domestic violence, needs of children, stress reactions and self-care, people with disabilities, alcohol and substance abuse. So these were the main priority areas that all countries wanted to focus. Yeah, so next slide, please. Right. So after prioritizing the priority areas, then we want to know the priority skills and knowledge areas for each country. And we basically followed the same process. So based on the 5 modules of the IAC BPS guideline, we asked all of our partners to prioritize the skills that they want to focus. For example, if someone wants to prioritize a certain skill or knowledge area, that they get the opportunity to prioritize from 1 to 5 scale, like 5 being most important and 1 being the least important. And based on this exercise, we were able to identify the priority skills and knowledge areas for respective countries that really helped us to sort of understand to which direction we should go in. If you can share the next slide, please. Yes. Similarly, we follow the same process to understand priority training groups for each country. This was really helpful for us to develop our narratives for the stories. So when we developed our narratives, we already had an idea on what kinds of characters that we should include in our stories. Next slide, please. Yes. Then our team did another activity to get more details from all our partners to help us with the script development. So here we asked everyone to share possible scenarios that would work for their country context. For example, we asked them to share what kind of theme or what message they want to deliver. What is a sort of cause of the problem? What is the reason for the problem? Who will likely to sort of respond to the problem, and so on. So this also helped us to come up with potential scenarios for our stories, and our team developed the stories and shared with the 3 country partners. Then we reviewed in our scripts, reviewed our scripts in our partner meetings, and also like we contextualized those scripts to fit into their respective country contexts. And finally, we finalize the scripts for our stories. Next slide, please. Yes, I'm not going to take much of your time here, but you can see here how we worked on translations. As I said earlier, like we worked across 5 different languages for this course. So we asked everyone to share their translations as we finalize the English script for our story. So this is just to give you an idea of how we worked on translations. Next slide, please. Yes. Here I wanted to share how we developed the characters for our stories. As you know, like we had to come up with a common platform where all 3 countries represented, but with the limited resources and the time we had, we could not like cater for all our needs. Like we wanted to find an alternate solution for this. Therefore, we asked all our countries to share images of similar characters we are going to showcase in our stories. So after that, we shared these images with our illustrators, and they came up with the character options for us to select. And I think this approach really helped us to use our resources more efficiently. As you can see, here are the different options that they shared with us, and we had rounds of review meetings to finalize these characters as well. Next slide, please. And also, like while we finalizing the characters, we also worked on storyboards So the video development team shared the storyboards with us, and we followed the same process to check with all our partner countries in a couple of like partner review meetings, and then we finalized them. Next slide, please. Okay, I'm not going to talk about the video development process in detail, and we have a session during this webinar for you all to watch the final videos, but sharing a screenshot of our e-learning platform and how it looks like now. And also, as I said earlier, we are making some improvements as it goes along. And if you have any suggestions, please share with us after watching the videos or even after this webinar. And thanks for everyone. And now I will hand over to Suraj to share his experience from a participant point of view in this whole process. Suraj, over to you.
Thank you so much, Alaka. And it's very privileged to be here and to talk a little bit about our experience developing this, the platforms. It is really indeed a very great teamwork that I felt. So while developing this course and actually materials, we had I just talked a little bit more about the Nepal's point of view. So Alaka, he has already mentioned about all the process. But in Nepal, what we have done at the initial stage was, we identified few people who actually work in this process from our own team members. And then we had a several round of, the consultations, meetings that we have, done with the team members. It's more than 15 consultation meeting with the experts. And then when the pictures, we worked a lot with our people in the field to identify the proper pictures to be used in this, the videos and other sort of materials. That was later on shared to the field team also to verify whether those pictures will reflect the context of Nepal or not. And then we actually widely disseminated it for the users. So this is the process that we applied in a very short that I'm trying to emphasize here. But the key learning actually in this whole process from our point of view is it gave a lot of opportunity for us to understand better about our community context, because the language, the ecological diversities that we have in the east and west, north and south is quite different. And it has given a lot of opportunity for us to talk within our team members how to understand the custom, the appearance, the gestures of the peoples, and the day-to-day life of the people. That is the key learning. And at the same time, it was also a bit difficult, in terms of finding the commonalities. For example, we are working in 3 different countries, and also within the country, there's also different diverse, context. So I think also coming within the the consensus, it took a lot of time internally to the discussing with the team member, also in our the whole range of people in the 3 different countries. I think that was a really great experience and also great learning for our whole team members. So very happy to be part of it process. So I'll just stop here and would like to hand over to Iris for her experience and her point of view during this process. Yeah.
Thank you, Suraj, and thank you for the ability to speak, and welcome to everyone. On behalf of the Timor-Leste crowd, it was such a fun experience. As you can see already from what Aloka was telling a little bit about the process, right? It's pretty in detail and lengthy in time, but it was extremely enjoyable. And I think from our part in our team in Timor-Leste, we had so many discussions about clothing, about hairdos, about what would people wear the skirts above the knees, or over the knees, or what, more curls, less curls. It was very interesting to go into all that detail about how can people identify with what they see on the video. Extremely important to be able to do that when you work across 3 countries as well. So that was one point. Really, the eye for detail is extremely important when you develop this. The second thing I think important to mention is we had lots of discussions. Of course, when we developed this, we were still in the COVID period, where people wear masks, and of course a lot of the issues were around that. So we're talking about the shelf life of this online training, and that it's extremely important to make sure, you know, develop this for just a year or two. So we took away, of course, specific mentions of COVID. So we're talking about, as you will see, about the virus. We're not talking about coronavirus. And make sure that in 10 or 5 years, it's still, you know, applicable. The third thing that is important to mention is, of course, the psychosocial issues that we display and how we display it. So we want to make sure that we don't stigmatize further, but that we actually display the psychosocial issues in a way that they are normalized, that people understand this is something that can regularly recur to people. So it was important to make it relevant and to make sure that there was no stigmatization. So yes, overall, it was an extremely pleasant experience, and we have to come up with more, otherwise the team has to leave each other, which would be very sad. So with that, I will pass it on to Rehan to mention a little bit about the experience from Sri Lanka.
Thank you, Veris. Thank you. And yes, so I'll just bring into like 3 points. I think firstly, from my perspective, it was very important to contextualize the issue because we were working with Emmanuel and our role and my role as a participant from Sri Lanka, working with the participants from 2 different countries, was to really maximize the cultural validity of the content. And it's also not just maximizing it, but understanding where to draw the line and where to sort of compromise, where to balance it out. Because it's not that, you know, the story needs to not be relevant to just one country, it needs to be relevant to 3 different country contexts. And even though we are technically all from South Asia, there's a lot of variation, cultural variation between 3 countries. And secondly, the challenge was actually twofold. Like Aloka said, there was an exercise and many discussions followed by that to identify certain fundamental skills that would sort of be applicable in like different contexts. And then we also needed to present it in a way that the first responders from 3 different countries could really digest it. The skills needed to connect to the issue, because we have identified priority issues first, followed by identifying skills. So the skills and the issues needed to have a connection, and the certain techniques, the methods, the little sort of nuggets of knowledge that we were sharing through the videos needed to be feasible, and it needed to come through very clearly so that the content was, you know, digestible for the participants. So this included a lot of discussion and also the process to identifying relevant people to respond to that issue. So it was, you know, in a way there were like 3 different variables that really went into developing each of these modules. And lastly, we had this sort of evolving conversation of who this platform was really being designed for, because initially we were using the term of first responder, frontline worker, responder, etc. And usually when we think of responders, we think of like doctors, nurses, firefighters, maybe some government staff, maybe some social workers. But what we really realized over the course in the process of development was that, in a way, during the pandemic, all of us became first responders, right? We were responding to issues. You know, if a relative got ill, we would call them up. We would sort of check in on them, check on their well-being. If a neighbor got ill, you know, we would try to share whatever food that we had. We would try to talk to them and see if they're doing okay. So in a way, what we thought was, yes, these skills were for first responders, but these skills are actually, these skills need to be available for everyone. So in a way, who this program was for was, also evolving. And towards the end, not towards the end, actually, people are, even before this course was introduced, people are generally geared to help others. And what we realized was BPS simply allows you to become a better helper. And also this was like a conversation that we had towards the end when we were thinking of, what do we need? What do we name this platform? And we had like multiple discussions on, okay, what kind of name are we giving it? Are we going to call it BPS? Are we going to call it like some skills? And then we were like, what? No, we are going to call it what it is, and we decided to call it supporting people during difficult times.
Thank you, Rehan. Sounds like a very detailed, impressive process. But what was the outcome? Ananda, could you take us through that a little bit? And to the next slide, please, and Anand, you're on mute.
Thanks. I'll so what came out from this, and we'll see the slide in a second, was a course that was built around 6 mini modules, each of which contained one, and two of them contained 2 videos, 2 short videos, usually about 3 minutes in length each, that people could watch. And each video and each narrative, as you saw from Aloka's description, incorporates elements of basic psychosocial skills, knowledge, and practices as extracted from the BPS manual. And each module that a person takes is then followed by a quiz. And the purpose of the quiz is not so much to only to test, but actually to reinforce learning of elements that might have been implicit during the preceding videos, to get people to think about the video and what they saw, and be more conscious of it. And then once they've gone through all the modules, then there's a final quiz or evaluation that actually is meant to see whether you've taken in and incorporated and integrated learning across all the different BPS competencies and modules. But again, even this is in the context of application, not sort of just abstract ideas. So with this, actually, I'm going to segue now to the next bit, which is a small lottery. Can we have the next slide, please? So each of us is going to get a chance to participate in one module, watch one video or one pair of videos that comes with the module, and also then see some of the quiz questions that are used to stimulate learning. So unfortunately, we can't, it was complicated to let everyone choose their own breakout rooms. So we will all be randomly assigned, and I'm just going to open the room now.
Thank you, everyone. Welcome back. Hope you had interesting and insightful discussions in your breakout rooms. So right now, because you know what the course looks like a little bit, we would like to know from the countries how they implemented it. So first up is Nepal. So Suraj, we would like to hand over to you to see how it was implemented there.
Thank you, Saraswati. Yeah. Well, in terms of implementation from the point of view of Nepal, we have, as of now, is 30 events that we have formally carried out to train and orient total number of 1,762 people in this basic psychosocial skills using this platform. And then after, we also actually adopted that platform into our TPO Nepal's website system, where we have found around 80 people already got enrolled and participating in this course. So which is very interesting, and it's very exciting for us to how people are getting interest in this course and trying to get more information on basic skills of psychosocial support. So while implementing this course in a various setting, that what we found was, uh, uh, having a physical orientation is more is lively. Is people are get more interested, and when because what we TPO in Nepal, what we do is, and we didn't separately organize this TPS training in many cases. In ongoing training, we actually integrate this the course, and then we try to convince the people to get into the course and go through the different sessions in the different thematic areas, get the quiz and see how they actually understand the things, and then come to the conclusion. So I think it is really nice in terms of having this the physical orientation. That what we found, though the system itself is also developed for the all the in a virtual platform. And also we have, what we found is, if we can provide a little bit, the very brief informations about the mental health and psychosocial issues, then it will be easier for the participant to understand, though it is not required. But in our training, in our orientations, we actually talk a little bit about in 15-20 minutes or sometimes half an hour what is psychosocial, because this is for everyone. This is for all the frontline workers who are actually supporting people in a difficult situation. So that's why I think if we can have some sort of mental health psychosocials, the brief overview at the beginning of the session, then it will be very easily the adopted in the various contexts. What we found is, this course is very important and very nice, worthwhile alternative platform to integrate, the ongoing training regarding psychosocial educations. In fact, some of the training that it is a very, important findings that we found is like, in some of the training, when we introduce this course, then we actually reduce our original a schedule, original curriculum, because so many things has been covered here, and it is very easy to understand for the people when they looking the going through the videos, and videos have stories, and then after the stories they have a quiz, which is also something very tricky and interesting part of the process, and then the people get more aware, more sensitized, and it seems like people get very easily understand what we are trying to deliver them. So this is very this is what we found is very important and very exciting, the alternative platforms for the people to understand about the psychosocial issues. Next slide, please. Well, we have some, the reflection from the participants. One of the, the people, our colleagues, Divakar, who actually went to the field and asked to the, the people who actually participated in this course. And one of the case manager who was working in one-stop crisis management center, she was saying like, what she said was, in her terminology was, I learned about the case management and communication skills needed for domestic violence, stress, drugs and alcohol abuse, and stress management skill, which are the different modular that the videos and the course that we have just seen in a breakout session. The videos and the content of the basic psychosocial skill course were like a version, like a revision for me, because these people already got some sort of training in psychosocial support, but now this course is actually a very refreshing for them to the revise what they have learned in the past. So I think is very that's the one. The another respondent was a school nurse who also took this the course, and she was saying like, I have been using the skill of basic psychosocial support course in my daily work. I have learned the skills of identifying the mental health issues in the different individuals, providing them with the right information, linking and referring them to the relevant services, communication and providing psychosocial counseling, the basic counseling she was actually referring for. So these are some of the the course from the participants, but there are several others we have, and also it's not only their testimonies, but also their reflection during the time of orientations, how they actually replied us, reflected the process, and also the engaging in the videos, stories. I think that was something very encouraging for us as a team working in this platform, working in this course. With this, I would like to stop here and would like to hand over to Rosa from Timor-Leste for her, the experience working with this course. Over to you, Rosa. Thank you so much.
Can you all hear me? Hello?
Yes, Rosa. We can hear
Yeah,
you.
hello. Okay, thank you. Nice to meet you all. Yeah, I would like to share some insight from Timor-Leste for the online course on TPS. What we are doing is the promotion of the online course has been very important in Timor-Leste. I mean, we also involved in the phone conversations to explain about what is the online course is. And we also did the promotion visit to selected interest organizations, national and international NGOs. It's an introductions letter to the government officials, NGO, and other institutions, such as university as well. As a result of that, we can see there are 188 people have registered for the course, and 73 people have completed the course. In Timor-Leste, there's some assistance was required, both individually and in a groups, as people found it hard to register or take the online course. As online course in here is relatively new for many Timorese people, except for people that works with international NGOs, and they might have mandatory course and requirement from the international NGOs. But for the local, the communities, the national NGOs, it's quite relatively new to use the online course. Second internet connection has likely been main issues for people not completing the course, and it's caused frustrations and takes time to complete the course. And the other things that mostly from the participants, that is from the organizations, they are also recommended that provision of the certificate of the completion at the end of the course is highly important here, as it is also can be one of the evidence requirement while they have to apply for another work that related to these issues. And as the course is contribute to basic psychosocial skills, it seems as it's an important requirement for all staff within the Asia Foundation itself. Might have been discussed. It might become a part of the induction course of the new staff, and it also has been raised by national organizations that work directly with to support the victims of GVB. And they say that it will good to be a mandatory course in their organizations and to be a refresh training for every year for the staff to refresh and to evaluate how so far their services and counseling and supporting the victims in difficult times, especially for the domestic violence and sexual abuse. And organizations also ask if they can be provided with the video so they can use that as a tools in training. There's a number of organizations and that work in providing assistance to the victims. They have decided to use this course, especially as in Timor-Leste, we have a new re-elected local authorities. So as you know, that local authority is become a first line of reporting for the victim of GVB. So this video is a very good tools, training resource that we can provide the informations and skills to support the new re-elected local leaders. So they can have a basic skills to support people in difficult time when it came to them, and how they can refer that to the organizations that works on for providing services to the victim of GVP. Next, please. Next slide, please. Yes, here's some quotes that we got from our participants that has access to the course. Like here we can see that I support patients who suffer from tuberculosis, TBC, and when they start treatment, they have a lot of worries and stress. And I hope that through this course, I can enhance my ability in psychology to help and give advice to people who face difficult and stressful situations. It's the expectation they are taking the course. And there is also they received information about the course from the colleges. As a professor that teach in the university, they see that this course can increase the knowledge, so then they can help the students in difficult situations. Another course after the completion of the course, there is a quote say that participants say that this course is inspired me to call my son's teacher to ask for specific sport that I never considered that, specifically when they saw the film about the teachers and education's videos. Another is the course reminded me how important is non-verbal communication is. It's like as eye contact, how to support to make people feel comfortable talking with us. And as the result of the course, I supported my neighbor who has experience in domestic violence. There is the participant shared her experience, how after she took this course, she can support the neighbor that have experience in domestic violence, and really see how she can move from the experience before, after the neighbor is get her support in that. So she's very proud and to have this course, because this is a very first opportunity to her to attend this course. During this, she's an administration officer. She said, for me as an administration officer, it's very important for us. And then because we have connect with our neighborhood, our families need our support in us. And this course gives me really important skills, how to communicate with other people. And another one is this course is very important to us for our organizations, because we have worked to provide support to the victim of GVB, as it is very important to ourselves and our family itself. So it's not only how we can, they share how it's also important for themselves, because they also know how to manage their stress itself, and how they also can support from their family itself before they also can support other people in their neighbors and the workspace. I think that's for me from Timor-Leste. Thank you for listening, and I offer it again to Rehan, please.
Thank you, Rosa, and thank you, Suraj, for sharing your insights from Nepal and Timor-Leste. So, hi, my name is Rehan, and I'll be sharing some insight from Sri Lanka following implementation. So, yeah, so to start off with, in terms of really sharing and disseminating, the platform was launched at the peak of the socio-political crisis in Sri Lanka in March 2022, followed by the economic crisis. So it was indeed a difficult time for everyone. Right now, even though we are bouncing back, a lot of people are finding it very difficult, and some people are actually not bouncing back. So still it is. And when we launched the course, it was a very, very unstable period of time. And we thought it was very timely when we sort of did that. And the course itself was actually sort of shared in 3 different ways. So the course is located on an e-learning platform, which is accessible via the links that we shared. So the platform links were shared widely with people. We encouraged people to try it out, to reshare it. We shared it with organizations. Some of us went and had conversations with people who are, who are a little bit more influential to share the links and the platforms. And while we were doing it, we came across quite a bit of challenges in terms of there was quite a bit of sort of unstable internet connection related challenges. So it was, in some places it was not accessible simply because of the internet, and it has 8 videos, so it needs a reasonable amount of bandwidth to really play these 8 videos, followed by sort of the questions and etc. So that was a challenge. And then there were other technological challenges where people found it quite tedious to sign up, because you had to sort of register and then sign up for the platform. So that was again difficult. People found it quite difficult. So we tried our best to really adapt to it. We created these guides which we shared with people, so that the guides really broke down the process of from creating an email address to signing up. It sort of broke down the process. So we thought that would help. In addition to that, we also did this survey with regard to non-completion to better understand what helps you complete the course and what is really keeping you not completing it, because we are able to sort of understand who we are able to better understand and sort of and see if we can really improve to increase the number of people that takes the course. So once we have done that, we thought, okay, we need to do more. This platform is here. We are encouraging people to use it, but we can do more and we need to do more. So then we took it next, a step further. When we were able to do in-person sessions again, because when the course was launched, we were not really able to do in-person sessions because of the crisis. But towards the end of 2022, we were back and we were doing in-person sessions with people, and we thought, okay, why not really use this program and why don't use this material? So that was a second way in which we sort of shared and disseminated the platform. So if you see the shared screen right now, the very first picture on the top, that is sort of what a typical in-person session looks like, and how the course and how we are really sharing the course. So actually in this picture, the video is working, but the sounds are not working. So people are just clamoring around my laptop to hear it, even though they can see it on the screen. So we did all this, again, amidst technological difficulties. So not the easiest thing, but then we did manage, and that was a second way in which we incorporated and we used this platform material. And the third way was by taking this platform and integrating it into broader skill building processes. So Rosa mentioned how she's currently having conversations on introducing the platform into the induction process for new staff at Asia Foundation Timor-Leste. So that we did something quite similar. So if you look at the second picture on the slide, that is actually an e-orientation program for a volunteer organization that works in a hospital. It's a youth volunteer organization that works with children in hospitals. And as you can see, there are sort of different modules that they take. They take child protection and cultural competency, etc., like that. So we thought that this course would be really relevant to the kind of work that we did, and we recommended, and we were able to sort of insert it in as a third module. And it was also shared with state universities in Sri Lanka that also sort of incorporated some of the work that they were doing. And on the slide, you see there are some notable groups of people that we have been able to sort of work with: state councillors, government officers from the district secretariats, officers and officials from the child protection sphere of service, Red Cross volunteers, different volunteer organizations that are youth-led, yeah, so those are just some of the notable populations that we have been able to work with. Next slide, please. Thank you. So the course was actually, so just to really touch on a couple of things that we really saw as to why the course was successful. So I personally think that the course was successful due to the stories, the animation, and the novelty of the process. I think, like Anand said in the beginning, e-learning using animated videos is not really the norm for workshops and seminars and continuous professional development programs, at least in Sri Lanka. So this was the novelty of this program and the process. It really made the entire experience unique and memorable for the people. And the course is also quite simple. It puts through concepts, it puts through issues, concepts and skills and techniques in a way that it's digestible. So that really helps. So it really, and the course is also really able to capture the participants' interest quite quickly, right? Compared to just sort of switching on a slideshow, starting off with a video really gets everyone sort of focused, and then we usually follow it up with a conversation, and that really helps. And also something notable is that some of all of the videos really touch on key issues that the population is going through, and some of these things are not really easy to bring into discussion. For example, a conversation on self-care is actually not an easy thing to really bring into discussion with a group of like 20 people. But the video is structured in such a way that you share the concept of stress reactions, and then you also visually see why this person is stressed, and why this person is going through stress reactions, and through that the concept of self-care is introduced. So I personally found it very useful when really using it to discuss the concept of self-care, and people really got what it meant. And lastly, also the program was really, it didn't brilliant with other little tools and activities. For example, the second picture is actually a role play scenario, and usually in our training programs we have role plays for supportive communication. So we would show the video, videos from the second module on domestic violence, and then we would be really able to, and followed by that we would have a conversation about supportive communication, about what they saw and what they thought was missing and what they thought was helpful, any new skills that they picked up while watching the video. And followed by that we would have a role play. We would have a case, and then we would follow that up with a role play. And usually role plays happen in threes, where you have one person who takes on the role of the person who is going through a difficult situation, the other person who's helping, and the third person who's moderating, so that they're able to take a third person perspective and share what could have been done better. So in addition to the SPDT material, it was used to complement with different activities and different tools that are all very familiar to us, and overall all of it together is what made these training programs memorable and useful for the participants. For example, the third picture, where one would say it's quite a bizarre picture, a lady covered with sticky notes. This is actually following the self-care video where we had discussed stress reactions, and we get the participants to really brainstorm on how each of them would experience stress, and we would write it on sticky notes, and we would have this person and then paste it on this person. If you're having a headache, you paste a sticky note on the head. If your fist clench, automatically we would paste it on the hand. So these interactive games it really helps drive the points home, and specifically experiencing, seeing it and experiencing it, and then following it up with the discussion and making the process of training more diverse. It really helps. And the third slide, the next slide, please. Thank you. Yeah, so my final 2 points. And the other thing which I found was quite important about the program, about the board itself. We initially for us, we grappled with identifying an issue and skill, and then sort of bringing in cultural validity into it, and then connecting. And what really helped to connect the issue and the skill and share it in a nice way is the story. But later on, what we realized was all of these stories really tell something really close to people's heart, and some of these stories are actually they actually bring in conversations, and they bring in perspectives, or rather experiences that are in a way taboo and not so conventional in society. For example, domestic violence, we know that it exists, but it's rarely really spoken about. So partly, even though the video itself is on supportive communication, it also gives the societal issue a form of visibility. And partly I'm really glad we really got to do that. Specifically, one of my favorites is the video on the needs of persons living with disabilities. And often, if you're not a person who's experiencing any form of disability, you are not, chances are you probably do not really think about things like accessibility, or emergencies, etc., and the needs of these people who might find certain things, who might need extra or focused care. So in a way, the story is also not just it doesn't only communicate the skills and issue, but it also really communicates a story and real issue that needs to be talked about. So I really thought that was very interesting, and the participants really liked that sense. And lastly, during the process of implementation, because we had sort of an year-long process of really evaluating, looking at what's working and what's not working, and trying to make adaptations, and also while doing all that, we were disseminating and we were implementing, trying to use it in different ways. And one thing that I really felt was that we really need to make the time to implement the tools that we develop. I'm pretty sure a lot of us come from different organizations or groups of people, practitioners. We end up creating tools. We spend a long time researching, putting tools together and sharing them. But then the sharing process and the implementing process is usually towards the end of a project period. But the thing with our experience is that we really need a longer period of time to implement. And all of these learnings that Suraj, Rosa, Iris, and I myself are sharing is our experiences implementing and understanding what is possible and what is not possible. So that was actually one of my personal learnings about how we really need to make time to digest a tool after it has been made, and also to really take the time to implement it so that we can learn to do better. And yeah, so that is really all from my end. Over to you, Sadhani.
Thank you to all the speakers so far who have shared extremely interesting insights on how this works on the ground. Because at the when we began this webinar, we were initially talking about e-learning course, but looking at how it has been implemented in the different countries, it sounds way more than that. So it has almost been like a stepping stone to so many other things and used in so many diverse ways. Which, next slide, please. So now that we are in the Q&A session, I will sort of try to see if I can get you to reflect on what are some of the best ways that you found this synergies to work, like different pieces put together, because you have the online course, you've used it as a hybrid tool, you've used it in trainings, you've used it with a mix of other activities. So amongst all these different ways of using this, which ones did you find to be most effective? Maybe I'll direct first to Suraj and the team from Nepal, and then we'll take it from there.
Thank you, Sadhani. It's very relevant and very important questions. Of course, in many areas, when there's no internet connections, it's good. I think, what we found is, people are more feel easier to do in a hybrid models. Sometimes, as I said in my presentations, we actually build this course into ongoing training program. And what we did was, we played the video, we showed them, some of the questions, quiz, and then got their reflection. So that was something very easy to get into it, because in many cases, what we found at the initial stage, so many people, they didn't have their email address too. I mean, if you don't have your email address, and somebody, they have email address, but they don't remember their password. I mean, these are some of the technical problems that people are facing in the rural community. And when you don't have a very strong internet connections, then sometimes also difficult to play the videos, also to go through the process, from one process to another process. So it seems like, of course, we need to adopt, we need to bring the new innovations, new technology, but also at the same time, we have to see in a different way how we include as much as people, those who do not have all this access in their the location. So I think what we found is that the number that is more than 1,700 people that get enrolled into the courses is not all online. It was mainly, it was in the physical training that we go there, we interact together with them, we show them the video, and then that's also included in that number. So in some cities area where the internet connection is good, the people are a little bit more aware and literate on the technical aspect, then it's not a big deal. It's still is doable, is very relevant for those people as well. So that's the experience that we have.
Thanks, Suraj. And Iris and the team from Timor, when you implement this in a particular context, do you sort of look for any existing conditions that will sort of help you to sort of navigate this better? Is there any sort of prerequisites that the context or the setting itself has to fulfill in order for this training to be successful? Iris, you're on mute. Sorry.
Thank you for the question. Yeah. So yeah, some of the conditions that are already mentioned, of course, is, the internet, that is an important, condition for to be at a completely self-help online learning course. But then, other conditions as mentioned, can be in a classroom condition as well, which was really, really beneficial. And another way that we have done in East Timor as well, as Rosa can mention, is that she is like a help person, so they can ask her questions, so they can do it, but then she's there to ask, help maybe getting online, getting the password, and that was also really beneficial. Is that correct, Rosa? Not sure if Rosa is still online, because there are, as you can see, internet connection difficulties with East Timor at times, and I'm in Melbourne. Yes, so and as I mentioned before, we have really seen the use of it to make it maybe mandatory within organizations for people to do this as an onboarding exercise, and people, you know, have really expressed their enthusiasm for, you know, when they were able to do the course and when they were able to see the videos, and really, really eager to learn and to put this in practice. And a lot of people that has also said, I've used it for, you know, supporting my family, right? Besides in my work environment.
Of time. So one last question. I would start with Rehan, and maybe and Suraj can also jump in. Just to know, is this course enough in terms of the whole gamut of things that people are facing these days? How do you address, or what if people have greater psychosocial needs? Then how do you manage that?
Yes. Well, the course only offers, unfortunately, the basic psychosocial skills that the one would need. But I think for many people, this is where it really starts. Because in my experience, a lot of them are going through, a lot of participants that we have worked with were going through difficult times, either personally, you know, because of, you know, the different crises, but also, you know, quite a bit of them were also providing services to people, and you know, they were finding it, you know, finding things like self-care quite difficult. So for most of them, this program was really that sort of wake-up call in a way, like, okay, you know, we need to start thinking about these kind of things. In one way, for many of them, it was also kind of revision, a more formalized way of revising. You know, as I mentioned before, people are able to help, and people, you know, people help each other on a daily basis. But this really, in a way, formalizes and help people understand, like, okay, so if I'm having a conversation, I need to think of, you know, how I verbally communicate and also non-verbally communicate, right? People are non-verbally communicating. I'm not saying that they're not, but it really sort of brings those skills and the importance of that to light. So finding more support, if it is, you know, people might need that, and partly after our lot of programs that we do in person, we do have some conversations with certain people who say that they would like, you know, certain referrals, or sometimes, you know, when more personal things come up during conversation, we would have a chat later on, just to, you know, understand where they could be referred to, or, you know, for more support, of, you know, to better understand what they're going through, etc. So yeah.
Thank you, Rehan. Asia, Suraj, any additions from your end? Yeah, I know I said one last question, but one last very important question to Ananda, because since this is very interesting, what if other countries, other contexts want to sort of adapt this sort of course into their settings? How can they go about doing them?
Thank you. Good question. So the original content that the course is based on was the Basic Psychosocial Skills manual, and which it's published under a Creative Commons license, where you can use the content. You have to reference the source, and as a result, the course itself has been developed under the same licensing conditions. So it's basically an open source course, as long as you acknowledge the source. And I think for all of us who've been involved in it, we're very keen for colleagues in other parts, well, to take it and use it, change it. I think the earlier version of the course, actually, before the SPDT, the first version 1.0 was actually taken by colleagues in Myanmar and adapted there. And I think we'd very much welcome this in other contexts as well. But of course, we have not yet put everything up online to kind of just download it. But I would say that contact any of us involved in the webinar, I think we're all on MHPSS.net, or you can Google us. Maybe we'll put our email contacts in the chat afterwards if you want to reach out. But we can help in the share our process, even some of the tools that we use to do this, and discuss how you could do this and maybe set it up on your own platform, or perhaps even collaborate with the platform that we have set up as well. So that's the short answer.
Thank you, Andrew. Very exciting things to come, I suppose. And before we close for the day, could you share with us how people can access the course? Slide,
Yes.
please.
Thank you, and thank you, Sadhani. And well, I really hope that this webinar rather, has been has sort of allowed you to better understand the process that we engaged in, and also followed by the different things that we did for implementation. The course, even though it was used in so many different ways, is primarily available through the link here, as you can see on the shared slide. So if you go into this link, even though within breakout groups we only use the English videos, as mentioned before, the course itself is available in Nepali, in Tetun, Sinhala, Tamil, and English, and it is accessible through the link that you are seeing right now. So do try it out. Do share it with colleagues if you think that they might like it. And yes, that is really all from my end.
And do share your thoughts and comments and reflections on it. I think that's really helpful, because it's an ongoing journey of reflecting, adapting, and evolving. So finally, thank you so very much on behalf of everybody who is engaged with this. Thank you for joining the webinar. Before you go, please use the Zoom poll to give us your feedback on this webinar, because MHPSS.net hosts many webinars and we would like to improve how we do things as well. So thank you very much. Hope you'll have a lovely day, and see you next time.